Welcome to the ClearTriage video training series. In this video, I'm going to show you how to use ClearTriage to triage and document a call in your EMR. In our example, a mom has called who is concerned about her son's first case of hives. I talk with the mom, asking about the duration and severity of the hives and listening for other potentially higher risk symptoms and otherwise using my nursing experience to assess the patient. In this case, I determine that I do want to use the hives protocol. Here is my list of protocols in alphabetical order. I can type in the search box to narrow that down and find hives. In this example, I'm in a ClearTriage family account with both adult and pediatric protocols. Notice the adult protocols have the blue A's beside the name of the protocols. The pediatric protocols have the green P's. Because this is a pediatric patient, I will select the pediatric hives protocol. Once I select a protocol, I can see additional information related to this protocol on the right-hand side of the screen. There are two important sections that I should review before using a protocol, including the Use This Protocol For section and the Use a Different Protocol If section. The Use This Protocol For section will list the indications of when it would be appropriate to use the selected protocol. For example, I can see that I would use the hives protocol for an itchy rash made up of raised pink spots with pale centers. I also have some symptoms of hives listed for quick reference. Additionally, I'll want to take a look at the Use a Different Protocol If section. Here I can see other protocols linked that I may want to consider in these situations. For example, if a food allergy is suspected, I would want to use the Food Reactions General Protocol. Below, I also have some additional resources, including detailed background information such as potential causes of hives. All of this helps me to confirm that this is the protocol I want to use. Next, I work my way through the prioritized list of triage questions, using the information Mom has already given me and asking additional questions along the way to rule out more serious problems. Once I arrive at a question I would answer yes to, I select that question. This determines the disposition for the patient, which in this case is home care, since they have hives with no complications. Notice that I can also explore the rationale behind many of the questions by hovering over the gray information icons next to the right of the question. Next, with the care advice available as a reference, I discuss the appropriate advice with the caller, clicking on the check boxes as I discuss each item. I'll let Mom know that over 10% of children get hives one or more times. Most of them are part of a viral infection and they are not an allergy. Less than 10% of hives are an allergic reaction to a food or drug. And sometimes the cause is not found for about 30% of hives. Maybe I'll also provide some information on using cool baths for itching and talk about the expected course. I make sure to discuss the reasons to call back, the most important advice to cover from both a safety and a liability standpoint. I can also select the appropriate medication dosage for the child, and that dosage recommendation is included in the call note. Finally, ClearTriage includes care advice handouts written by Schmidt-Thompson at a 6th grade reading level. These handouts can be emailed or texted to the caller in order to reinforce the care advice discussed. For this call, I will send the handout to Mom in a text message. Now that I'm finished triaging the patient with ClearTriage, I'm ready to transfer my call notes into my EMR. I press copy and then switch from ClearTriage to my EMR. In this case, we'll be using Cerner as our example. I'll right-click and choose Paste to insert my call documentation into the same field where I previously typed my call notes. Notice the notes contain my initial assessment, the protocol used, the positive triage question, and the care advice discussed. And that's how easy it is to use ClearTriage. Thanks for joining us today, and make sure to check out the other videos in the ClearTriage video training series.